Unlike THC, which we discussed in a previous video, you can find the link in the description, cannabidiol, also known as CBD, works through a slightly different mechanism. Previously we mentioned that our internal cannabinoid system, or so-called endocannabinoid system, has specific receptors in addition to the two main endocannabinoids, anandamides and 2-AG. THC, acting through CB1 receptors located mainly in the brain and nervous system, causes a number of side effects, such as excessive agitation, sleep and concentration disorders, anxiety attacks, and dizziness. Hence, the controversy over marijuana use is mainly related to its psychoactive effects, affecting brain function and perception, or in other words, its intoxicating effect. On the other hand, cannabis also contains CBD, which acts in opposition to THC. It is not intoxicating and has anti-anxiety and antipsychotic effects. CBD binds to CB1 and CB2 receptors in a small extent. Its action is largely dependent on the vanilloid receptor and others. Moreover, CBD also enhances anandamide and 2-AG signaling, thus indirectly modulating our own endocannabinoid system. A comparison of the effects of the two most popular cannabinoids, THC and CBD, is also illustrated in this table. So we can see that two substances derived from the same plant can have completely different, even opposite effects. The main component of marijuana responsible for these effects is THC, which in large quantities can cause anxiety or psychotic states and for this reason is illegal. On the other hand, CBD has no such negative effects, which is why its usage is legal. Moreover, because of its antipsychotic and calming properties, it is used in the clinic, which we will return to in a moment. Numerous studies indicate that CBD has sedative and anti-anxiety effects. Antipsychotic, meaning it reduces psychosis, inhibits epileptic seizures, and neuroprotective, meaning it protects nerve cells. These positive properties of CBD have made it increasingly popular, especially among young people. The popularity of CBD is illustrated by the constantly growing number of stores offering a wide range of products containing this cannabinoid. The most popular are oils, but also jellies, gummies, chocolates and cookies. The good news is that studies show that CBD is relatively safe and rarely has side effects, as well as no addictive potential. Side effects might include nausea, loss of appetite, or headache, but these are usually mild and temporary. Importantly, products containing CBD are supplements, not drugs, and there are currently no institutions dedicated to controlling the quality and composition of supplements given on a label. Commercially available oils contain from 1 to 50% of CBD, less than 0.2% of THC, and small amounts of other cannabinoids. However, inspections regularly show large discrepancies in the actual CBD and THC content of a product compared to what the manufacturer declares. A US study of various CBD-containing products showed that only 31% of the products contained as much CBD as the manufacturer claimed on a label. More than 42% contained less CBD, while 26% contained more. Moreover, despite a number of promising effects of CBD, we should be careful about taking it on our own when we are also taking other medications. CBD can interact with a number of enzymes involved in the breakdown of substances and thus lead to changes in the concentration in the body of the drugs we are taking. For example, CBD can inhibit the enzyme responsible for breaking down the drug we are still taking, which will lead to an increase in the amount of the drug in the body, and consequently can cause adverse effects associated with an overdose. In turn, by reacting with another drug, CBD can inhibit its transporter and consequently lead to a reduction in the amount of the drug in the body. This will cause that our body will not receive a sufficient dose of the drug we are constantly taking. However, if CBD is used in controlled doses prescribed by a doctor, it can have salutary properties in treating various diseases. Because of its safety, calming and tranquilizing properties, CBD has found its way to the clinic. In 2018, the US Food and Drug Administration, FDA, approved the drug containing pure CBD in the form of an oral solution. A year later, the European Medicines Agency Committee for Medicinal Products for Human Use also approved this drug for use in the European Union. This is a drug called Epidiolex and is used to treat rare, life-threatening and chronically debilitating types of drug-resistant epilepsy, such as Lennox-Gastaut syndrome, Dravet syndrome, or in patients suffering from tuberous sclerosis. The drug has anticonvulsant, analgesic and anti-anxiety effects and can be used in children as young as 2 years old. In addition to its efficacy in treating epilepsy, recent preclinical studies and clinical trials indicate CBD's potential effectiveness in reducing the symptoms of neurological diseases, such as Parkinson's or Huntington's disease, treating pain of various origins, and lowering inflammation. However, not all results are conclusive, and further research is needed to confirm the beneficial effects of CBD in treating various conditions, as well as to bring the drug to the market.